Today I bought a cauliflower for $5.50 and a parsnip for $3.89. I'd better explain inflation. Oh, I also have some thoughts on telecom suppliers and their redundancy or lack of it and how they screw customers over. And before I go, oh yes, the decay in the Canadian healthcare system. Stay tuned, it's Sherman Unlimited.
You wanted real talk, and this is where you'll hear it. Uninhibited by the toxic influences of cancel culture, unvarnished and unfettered, unencumbered by the censorship of traditional radio, uncontaminated by big media interests.
And now, Sherman Unlimited.
There's a big issue out there right now that revolves around a word that all of us use. It's inflation. And the question is, what is inflation versus what does inflation do and why? Inflation is not the fact that I paid $5.50 for one cauliflower. That is the result of inflation. Inflation is actually the inflating or blowing up of the money supply. So if we have X trillions of dollars in circulation and the government simply decides it's going to print another X trillion dollars, that money goes into circulation as well, and we have inflated the money supply by a factor of 100%, and therefore we probably have doubled the prices of most of the things that we have come to expect at a certain level. That's inflation. The effect of inflation is those prices. Now, where does it come from? A lot of people are saying, well, you know, if you take a look at the gas companies, the gigantic oil companies, and you chart their profits, you certainly can see that this is about greed. There's no reason to be charging the extra money. They're just greedy, and their first duty is to their shareholders, and therefore they charge as much as they can get. Well, if you think this is as much as they can get, I have news for you, because right now, in the middle of Canada, the Toronto metropolitan area, gas costs approximately $1.80 per liter. If you fast forward 6 or 12 months, it is not impossible that that could be $5 a liter. I'm not telling you that it will be. I'm saying that it could be just as easily as it was 90 cents a liter approximately a year ago. Now, I know. We had a pandemic. A lot of people stayed in their homes. They worked from home or they didn't work at all. And part of not working at all is why the government printed a bunch of money. As far as this government is concerned, the Trudeau government in Canada, the money that was handed out under programs that were meant to address the shortfall or the lack of any cash flow coming from jobs that had to be left behind in some cases or curtailed in others, those pieces of paper that were printed as $20 bills or $100 bills might just as well have been coupons that said you get a free donut with every cup of coffee you buy at Tim Hortons. That's what they became worth. And there are a lot of questions that remain unanswered as to why we needed to print so much, because if you take a look at the situation we've got today, not only have we got roaring inflation, but we've got a lot of people who don't really want to work for the kind of money that they used to work for or anything like it, because they've got a lot of money that they squirreled away in the bank that the government handed out. The government handed out. What's the government? The government has no money. It simply manages money, manages taxes, manages where those tax monies are spent. The money is our money. So we're going to print money. We're going to give it to you. We're going to tax you. We're going to take it back. And we're going to call it our largesse that made you wealthier. And that's ridiculous. Take it a step further. So you've got dumb government. I've mentioned greed, but you've also got something called supply and demand. If you have very little supply and you've got a lot of demand, suddenly you have a reason to expect that the prices for the things that are on the market are going to be higher than you ordinarily would have to pay or expect to have to pay. I'll give you a simple example. Many people put off for a year or 2 years or even 3 years buying a new family car. And now they're looking. It's pretty hard to buy a car without having to pay list price. Maybe you want to buy a reasonable used car. Those are even more at a premium. So that's a matter of supply and demand. And there are a lot of things like that. Then if you add in the fact that almost everything you purchase that has to be delivered in a truck or has to come from overseas on a ship or from across the country on a train, you have the costs of the fuel and the costs of the labor for the people manning those particular conveyances that have to be factored in. So all told, we're in a mess. Looks like we're well employed. The country is running at minimal unemployment, but it also looks like we're running at a big shortfall in terms of the amount of interest that should be charged in order to rein in this inflation. If you think it's bad that mortgage rates have gone up from 1.9%, let's say, if you had a fixed 5-year mortgage, to maybe 4% for the same mortgage, I have news for you. A year down the road, don't be surprised if that 4% is 8% or even more. Once upon a time, in a period that was much like this, but wasn't preceded by a pandemic or anything of that nature, was affecting society during a time where I was paying a mortgage on my family home when my boys were very little. I was paying 13% and considered myself lucky because the going rate at the bank was 18 at the time. So don't discount what you can't discount. Quite the contrary, they haven't moved it far enough, fast enough. So have we got a government that's managing things well from a money perspective? Piss poor. And they should be ashamed of themselves. As far as my cauliflower and my parsnip are concerned, I bought them. Can I afford them? No. That doesn't mean I didn't have the money to buy them. I'm fortunate. I've been careful with my life. So yes, I can buy them. But not being able to afford to buy them is a matter of mental conscience. Should I be paying $5.50 for a cauliflower? No fucking way. However, I did. And that's the problem we've got. And if it goes to $11, God knows I might do it again.
Sherman Unlimited.
Okay, let's talk about how dumb a gigantic business can be without naming any gigantic business. Let's talk about your little business, your little store, or your little accounting office. If you value that business, you put the books to bed every single day and you make sure they're redundant. What does redundant mean? Most people use a simplistic computer program and they do their books and they take them up to current, which is 5 o'clock today when you close the business. And then what do? You probably put a jump drive into one of the little ports on your computer where you've been working, and you take a copy of those books away with you in your pocket. That way, if the business disappears overnight, you can reconstitute your books in about 5 minutes the next morning. That's simple redundancy. Now let's transpose that entire concept over to a gigantic communications business. I won't name any particular communications business, but let's suppose that somebody supplied you with internet and or television and or cellular and or home and business telephones and or point of sale debit terminals. All of that to the point where your services are supplying the needs of millions and millions of Canadians, and you're generating in the billions for your shareholders. At the end of the day, do you think there should be redundancy in that? Well, let me give you a little once upon a time story from me. I ran radio stations for most of my life. Radio stations have studios. If a studio goes down, a microphone breaks, an audio board packs it in, the studio itself stops being air conditioned and it gets up to 35 degrees in there, what do? Well, you go to the redundant studio next door. There's another audio board. There are more microphones. There's air conditioning that works. Guess what else? They don't have one transmitter out in that concrete block building at the side of the highway. They've got 2 transmitters. So if one goes down, the other one comes up. And guess what else they've got? They've got great big diesel generators or natural gas generators that can put out enough power to make those transmitters go even if hydro packs it in. So generally speaking, radio stations don't go down. And those are just radio stations for one company operating in one city that I happen to know about because I've managed them. That's an example. In the case of the great big communications company, do you believe that such a company should have a situation where internet on top of television, on top of cellular, on top of home and business phones, on top of point-of-sale debit terminals, and any other device that happens to operate on the internet should be packaged in such a way that they work from the same central hub? The answer is a clear-cut no. Now, if you have that situation and some major component fails or an upgrade in software fails, suddenly everything goes dead. You may have heard of a situation like this. And if a chief executive officer gets on television and says, well, they were doing a software upgrade on some major routers and things went awry. Well, if you've got major routers that feed an entire network of the nature I've described, don't you think there should be other major routers, maybe even in a different location? And don't you think that upgrade should be done offline to make sure that everything is functional before you bring those routers online? Then you can go and do the second ones. But it doesn't seem that we do business that way here in Canada, and now the government wants to get involved. I've read some people tweeting or on Facebook saying, wow, don't you think the government should run all of the telecommunications now that we've gotten to a point where we're so reliant on it? And my answer is, I don't think the government should be running anything. Ronald Reagan once said, beware of the following 9 words. I'm from the government and I'm here to help. No, I don't want the government doing anything of the sort. What I'd like the government to do is enact a very simple piece of legislation that talks about the necessity for having absolutely full redundancy for all telecommunications companies, serving at a level where it covers hundreds of thousands, and not to say millions of Canadians. That might be the only government intervention that I could get behind. Anyway, I haven't named anyone. I don't intend to name anyone, but I think we all understand the effect.
Sherman Unlimited. In your face.
Over the last weekend, a major hospital in a northwestern suburb of Toronto shut down its emergency room. No major accident, no major illness, no giant influx for any particular reason, just insufficient staff. It's a plague, and it's about money. And it's about an ancient healthcare delivery system. This is a big deal in Canada. I know I have a number of listeners in the United States, and what you guys like to listen to are stories from the American Medical Association saying, yeah, Canada has free medical care. I'll talk about that in a moment as well. But Canada has huge wait lines in the last little while because of the backups caused by hospitals that were curtailed or overloaded during the pandemic. You can't get in if you happen to have regular treatments for something like cancer. You can't get in very easily for something like dialysis. They've tried to make do, but it hasn't worked very well. Now here we are, pretty much out of the pandemic. We're into an endemic stage. We have people in hospital, yes, in intensive care, yes, but not very many people in an overall sense. We also have a number of hospitals that are trying to do the work that is allocated on the basis of the population. It's just not working. And it's not working because we don't have the money. People like to say that because healthcare is presided over by the national government but operated by individual provincial governments, that it's easy to blame the premier of an individual province. Take the province of Ontario, where Premier Doug Ford has been reelected about a month ago. $170, $180 billion to operate with. It's the problem Doug Ford has. It's what he's saddled with. There's only so much you can get out of the taxpayer, and there is, as they say, only one taxpayer. The same guy or gal who's paying municipal property tax and school tax, who's paying provincial income tax, who's paying federal income tax, who's paying the value-added tax, or as we know it, harmonized sales tax, or HST, just doesn't have very much left if you're trying to get blood out of a stone. And that's what it's come down to. The provinces are saying, we can spend the major portion of what we allocate on an annual basis, as I mentioned, in the biggest province in Canada, about $180 billion to do everything. We can take the largest portion of that and put it towards health, and they do. And the second largest portion and put it towards education, and they do. And the third largest portion and put it towards, I believe it's transport, and they do. But you know what? The roads aren't as good as they should be. There are people crying out for improvements in the education system and for the fixing of schools that are run down. And there are certainly people who are wanting to get procedures done or who need to get procedures done in hospitals who just can't get there. And in this case, most recently, over the last weekend, can you imagine having your local hospital shut down its emergency room, and you are the husband of a pregnant woman who's going to rush her to the hospital because she's in labor. She started having contractions. And suddenly the hospital that was 20 blocks away is now 5 miles away because you can't walk in the door of the emergency room. What about the people with heart attacks? What about the people who are mowing the lawn and got their fingers in the wrong place where the lawnmower is concerned? So many different aspects of daily life that involve hospitals and healthcare delivery, and suddenly, because there aren't enough people, an emergency room shuts down. I would not lay this at the feet of Premier Doug Ford in the province of Ontario, or at the feet of Premier François Legault in the province of Quebec. I would lay it right at the doorstep and put it right on the desks of the Prime Minister of this country and the Health Minister of this country and the people who look after public health generally. It's approximately 55 years ago that the country enacted the Canada Health Act. It was federal legislation that made it mandatory for provinces to dispense health care based on an allocation that came from federal tax coffers, as well as the collection of tax towards the same end done at the provincial level. By the way, in some provinces like Ontario, the tax is collected by one authority in any event. Bottom line, however, is there isn't enough money, and there isn't enough money for a variety of reasons. First reason is the act doesn't work anymore. Something that was put together legislatively 50 or 60 years ago serviced a population that had no expectations and was composed of very young families with very young children and more on the way. Today, we have a population that's aging rapidly. So generating new taxes by generating new families, by having people do the work, that's not functional. It's not the same population of Canada that we had when the Canada Health Act was drafted or passed. So it has to be revised, and it hasn't been revised. And it has to be revised in such a way that we have a couple of things change. One of them is that the federal government has to contribute more. We seem to have $500 million here and $1 billion there to help other countries do whatever it is they need to do. We have to save starving people in the worst parts of the world right now. And I understand us having that responsibility. But I've said before that charity begins at home. And where healthcare is concerned, we can't have wait lines. We can't have closed emergency rooms. We can't have a government that is intransigent on taking a look at a Canada Health Act that limits us to duplicated care, person to person to person. If you're poor, you get the same health care as if you're rich. Well, that's not true anyway. The wealthiest among us are people who can afford a private jet. If they don't own one, they can rent one. They can fly to Rochester, Minnesota, check into the Mayo Clinic, pay whatever is charged for whatever ails them, and fly back. And that's two-tiered health care. Maybe a fortune, maybe not me, maybe not you, but there are people who can do it. They talk about not privatizing anything in health care. But have you had to make use of diagnostic imaging, x-rays, MRIs, CAT scans? They're all run privately. They're paid for publicly, but they're run privately. So there is private healthcare delivery. The same thing is true of cataract operations. As we age, there are an awful lot of older people and an awful lot of cataracts. Those are done often in private clinics, and they're paid for by the same people who pay for any health care that is allocated to you, no matter what your illness, no matter what your ailment. If that can be done in private clinics, then we already have private health care there as well. We cannot have a catch-as-catch-can system, and we cannot have the same health care delivery that we accepted in 1969, 70, 71. And somebody has to do something about it. It is not a provincial issue. It becomes partly a provincial issue when cash is reallocated, when health authorities sit down at a central table with the federal government and come to the conclusion that it just ain't working. Have a great day. I'm Peter Sherman.
Sherman Unlimited.
Let Peter know what's on your mind. Drop him an email. info@petersherman.com.
Find future episodes wherever you find your favorite podcasts. So if you like what you've heard, tell a friend. If you really liked it, tell 3 friends. If you really hated it, tell 3 enemies. We'll talk again soon.